Hey, this is Nick Herman. I'm going to be talking about the Cal Skate emergency scenario. And to start it off, you're with your 6-year-old son at his friend's birthday party, so you get the notion that you're with a school-age childhood development. Following that, your son comes running up to you saying that Jose won't wake up, so you run over to see Jose, and he's laid flat on his back. And as you're running up, your son tells you that he was trying to skate backwards, tripped over, and fell. So the first thing you're going to do is you're going to grab your PPE, which is that of your gloves. And if you have eye protection, you might want to need that just in case there is severe bleeding. Secondly, you're going to do a scene size up, make sure that there's no hazardous materials in the way, make sure that he did not trip on anything, or if the scene is slippery, you're going to want to clean all that up and get that out of the way. Following that, you're going to get into your primary assessment, which is that of the ABCs. Make sure nothing is blocking the airway, and if there is, get that out of the way. Second is the breathing. Make sure you can feel and see that he's breathing. If not, then you're immediately going to get into CPR. And the same goes for circulation. You want to make sure that you can feel a pulse right there at the neck artery or that of the wrist. And if there's no pulse, then you're going to want to do CPR as well. Following that, you are going to want to make sure there's a level of consciousness. Now, if he does wake up from it, you're going to want to do a concussion protocol or a head trauma protocol, which is that of making sure that the head does not move, make sure that he's in a comfortable position, attain his consciousness level, and get more medical attention to help you out. Following that, you're going to want to make sure, do a secondary assessment, make sure that there's no other injuries following that on his body when he fell. You're going to want to make sure that he has a closed head injury, making that of when you fall or hit your head on something, your brain is just rattling around it in the skull. Now, if he has an open head injury, like a skull fracture or that of blood leaking from the head, you're immediately going to want to get gauze, apply pressure to that, and make sure that you make sure that you get his vital signs and note anything that is going on so that you can give it to the medical attention that arrives. Following that, you are working with a pediatric child, so you're going to want to make sure that you are talking to them at eye level, make sure that they are comfortable talking with you, and if not, you're going to want to get a parent. I mean, you should have the parent either way with you to make sure that the child is comfortable to say whatever he or she likes. Following that, you want to keep a level tone with him, keep it more upbeat, make sure that he's okay. Make sure that you're not too loud. That of with a head injury will cause more disruption to him. Like I said, you can with a closed head injury, you might not need to get 911, have them come over. You're just going to want him to take him to the doctors immediately to get even farther or better concussion protocol or head trauma injuries to take care of. Following that, that's about it that you can do until more medical attention can arrive, other than just comforting him and keeping up with vital signs and symptoms as well. Thank you.